Researchers are now calling Alzheimer's disease type 3 diabetes. Americans have right now show measurable brain shrinkage in the hippocampus. I'm Dr. Harlan Whitaker, 38 years in neurology. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should flooded your bloodstream to push that sugar into cells. But some of those cells, including brain cells, are not responding the way they used to. Eyes, kidneys, and feet. The brain is rarely mentioned. That is the myth. The reality is that the brain their energy production drops. Second, the insulin dysfunction triggers the same amyloid and tau protein accumulation. Insulin is a key. Glucose is the package. Your cells are the house. Insulin opens the door so glucose can enter the house and fuel the furnace. It causes something worse. The brain cells that cannot get enough glucose start to malfunction. They produce less energy. Their communications building the exact pathology that causes dementia. Before we go further, I need you to hear this. If you have any You take a diuretic. You take a proton pump inhibitor like omeprazole. Leonard was 71 years old, retired electrician from Cincinnati, Ohio. Leonard had type 2 diabetes for 12 He forgot they had dinner plans. He put the milk in the cupboard instead of the refrigerator. He expected for his age. I also looked at his metabolic history. 12 years of insulin resistance. A1C consistently above 7. Decline was not random. It was metabolic. Here is your first assessment. Check your most recent blood work for 3 numbers. Fasting glucose. Rarely tested, but is critical. If your fasting insulin is above 10 microunits per milliliter, you have insulin Do you feel sleepy, foggy, or unable to concentrate within 60 to 90 minutes? If this happens consistently, your brain is and juice cause rapid blood sugar spikes. Adding protein or fat to every meal slows the spike. Second, sedentary behavior. Muscle walk for 10 minutes after every meal. Post-meal walking reduces blood sugar spikes by 30 to 40%. first and carbohydrates last reduced post-meal glucose spikes by 35% compared to eating carbohydrates first. The in older adults with insulin resistance. Fourth, cinnamon. Half a teaspoon of Ceylon cinnamon insulin in addition to your fasting glucose and A1C. The insulin number reveals resistance that glucose alone combined. Step 3. Restructure your plate. Eat protein and vegetables first. Eat carbohydrates last. Leonard's A1C dropped from 7.5 to 6.4. His fasting insulin That shift in perspective made him take it seriously for the first time in 12 years. Write your age by researchers because the same insulin resistance damages the brain. 2. Prediabetes causes but uncontrolled blood sugar can make it so. I don't sell supplements. I don't run a memory clinic. I profit from you not needing me. Protect what you have. I'll see you in the next one.